I'm at the bitter end here. I've been hanging by a thread for a while.
Fighting kidney failure since 2018, pandemic backlogs mean Jessica Bailey is still waiting for a transplant, in a lot of pain with less than 1% kidney function.
It scares me, to be honest, in my position. As a palliative patient, they say they give you about a year. And if we're backlogged more than a year, then, my odds aren't very good.
Scared by the findings of a new report with a sobering headline, more than 4,000 excess deaths due to delayed care, unrelated to COVID. And that only covers the period between August and December 2020.
I don't know what else we need to do to make it more clear that we can't just focus on the pandemic.
Laura Harilak is an ICU doctor who has seen her share of COVID, but also too many chronic illness cases left untreated she calls heartbreaking.
Didn't or couldn't access care, or too afraid to access care, who come in with a very acute complication of that illness that could have been prevented. But ultimately, an acute complication that took their life.
In Ontario, in-person visits plunged for diseases including congestive heart failure and diabetes at the start of the pandemic, nowhere near normal levels by January.
Really getting a sense of how bad the health system was impacted really actually was quite shocking.
The report warns correcting the problem will take years and cost at least $1.3 billion to return wait times to pre-pandemic levels by next June. That's just for 8 surgeries, including cataracts and hip replacements, with more than 300,000 people waiting. The health minister pointed to campaign promises committing to address the issue and said the total number of delayed surgeries is actually much higher.
There would be approximately 780,000 delayed surgeries in Canada at this particular time.
The actual impact is much broader than that. So the $1.3 billion to get us back on track, I think, is really just a starting point of what is needed for the system.
Saskatchewan just resumed organ transplants, yet is still impacted by staffing shortages.
Becoming part of that statistic is scary.
The delay means Jessica Bailey's live donor is no longer a match. She's now looking for another with O-positive blood. Abigail Bimman, Global News, Ottawa.